name is Kristen Dutton, and my topic of interest that relates to wellness is sleep insufficiency. Wellness is an important subject of conversation that is often overlooked in our society. While people are on average living longer lives, the quality of life they are living is called into question. Complete wellness takes into consideration the entire aspect of a person following the 8-dimension model as presented by the Substance Abuse and Mental Health Services Administration. The 8 factors included are emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental. All of these contribute to overall wellness. Our societal practices have changed over the past several generations. With the advancement of technology, many of us have shifted from manual labor jobs to sedentary jobs and lifestyles. This is concerning to me as I am studying communications with the concentration on professional writing. With a future career that will largely be spent sitting and working on the computer, it will be important for me to include physical activity into my daily routine. Inactivity and excess stress are just 2 factors that can cause health concerns, such as impacting sleep patterns. We also live in a busy world that calls us to stay connected to one another 24/7. But research shows the need to power down and disconnect is important to overall health and can help with getting adequate sleep. To be a force for social change, we need to shift our attention towards achieving healthier lives by focusing on prevention. Currently, we are looking for ways to sustain a longer life, but at what cost? When we are unhealthy and unbalanced, what is the quality of life? Discovering the right balance is a key factor in achieving wellness. For example, when our work lives are in balance with the restful and social aspects of our lives, it creates a better balance. Finding ways to improve all aspects of our lives can lead to better overall wellness, and this can increase sufficient sleep. Many people in our society are living with and managing health problems such as diabetes, heart disease, high cholesterol, and high blood pressure, just to name a few. Many of these health concerns can also be a trigger for insufficient sleep. The positive aspect, that is medical advancement, allows for better treatment and care of many of these conditions. However, a negative concern is that we don't place enough emphasis on overall wellness because some of these conditions are preventable. There are also emerging technologies that allow people to better track their health. There are apps to remind people to get up and get active. There are ways to track everything from calories taken in and even into sleep patterns. Not regularly getting the recommended amount of sleep is a concern for many people. Michael J. Bruce published an article on WebMD saying that insufficient sleep and sleep disorders can have negative effects on health, safety, performance, and finances. Sleep insufficiency is an issue that affects all of us, whether as individuals or through those around us. According to the CDC, sleep is increasingly recognized as being an important issue to public health. Sleep insufficiency has been linked to motor vehicle crashes, industrial disasters, medical, and other occupational errors, making this a global concern. Sleep insufficiency can be because of sleep disorders such as sleep apnea, stress, work schedules, socioeconomic status, and 24-hour access to technology. Sleep disorders can negatively impact the health and well-being of individuals and lead to poor cognitive performance, increased accident risk, and physical health issues can cause poor quality of life. Sleep insufficiency can affect society due to increased workplace accidents and driving impairments. The National Department of Transportation estimates drowsy driving to be responsible for over 1,500 fatalities and, on average, more than 40,000 non-fatal injuries annually in the United States. The target population that I'm focused on is the adult population in the United States. The CDC reports that an estimated 50 to 70 million U.S. adults have sleep or wakefulness disorders. Dr. Roseanne Barker of Barker Sleep Institute reports that 1 in 4 males have a sleep disorder. Risk factors include obesity, disruption of circadian rhythms as occurs with working night shifts, and stress. The Huffington Post reported a link between sleep problems and poverty. The pendulum swings both ways. Living in poverty conditions can cause insufficient sleep, and in reverse, insufficient sleep can reduce the potential for educational or work success. Knowing who is at risk and is impacted by this issue is crucial in knowing how to educate them on the importance of consistent quality sleep. Treating sleep disorders can bring about positive results and can change the health of an individual. I predict the future of sleep disorders to get worse with the way our society depends on technology keeping people constantly connected and not allowing for time to power down. With obesity rates on the rise, conditions such as sleep apnea will persist as a health concern. Many people even trade rest for continued work or play. Some even see a lack of sleep as a badge of honor for being a hard worker. They do not recognize the devastating side effects. But better awareness of the seriousness of sleep insufficiency can change the future of the issue. My recommendation would be to have doctors inform patients of the serious repercussions a lack of sleep or sleep disorders can have on their well-being. Patients should work with doctors to pinpoint the cause of not getting enough quality sleep and devise an appropriate treatment plan. As a society, we need to actively spread information on the harmful effects of not getting quality sleep. Information sharing on this topic is key. People need to make getting enough sleep a top priority, just as they do with exercising and eating healthy foods. If sleep problems were more widely reported as a serious health condition, then maybe more members of the population would recognize the importance of sleep. In some cases, lifestyle changes are necessary. For others, it will warrant a trip to the doctor to diagnose a medical condition such as sleep apnea. But with proper medical treatment, better quality sleep can be achieved. There are many devices and apps available at relatively low cost to help people determine the quality of their sleep at home. This could be the first step in a strategy to discovering sleep patterns. The benefit of having a strong doctor-patient relationship can lead to better overall care and treatment and positively change the patient's wellness. Education and awareness on this topic, along with added support, then we can tackle sleep problems and put the issue to rest. Thank you for letting me share this important issue with you, and I hope you will consider how important good quality sleep is in your own life.